Is a posterior placenta a cause for concern during pregnancy?
Hello everyone. Today we're going to discuss a topic that might have caused some concern for expecting mothers, a posterior placenta. We'll address what it is, what it means for your pregnancy, and whether or not you should be concerned. The primary goal of our discussion is to ensure that you're well informed about your pregnancy. Remember, knowledge is power, especially when it comes to understanding the changes in your body during this significant time.
What is a posterior placenta?
First things first, let's define what a posterior placenta is. The placenta is an organ that develops in the uterus during pregnancy. It provides oxygen and nutrients to the growing baby and removes waste products from the baby's blood. The term posterior refers to the location of the placenta. If it's attached to the back wall of the uterus, closest to the mother's spine, it's known as a posterior placenta.
Is a posterior placenta normal?
So, here's the question many of you might have. Is a posterior placenta normal? The answer is yes. The placenta can attach itself anywhere inside the uterus, at the top, side, front, or back. All these are completely normal and have no direct impact on how the baby grows. In fact, a posterior placenta is one of the most common positions.
Does a posterior placenta pose any risks?
Having a posterior placenta is generally not a cause for concern. However, it's important to note that the position of the placenta can affect how the baby is positioned in the later stages of pregnancy. For example, if you have a posterior placenta, the baby may be more likely to adopt the occiput anterior position, facing down and towards your back, which is usually the optimal position for labor and delivery. That said, the placenta's position is not something you can control, and most pregnancies with a posterior placenta proceed without any complications.
Can the position of the placenta change?
Another common question is whether the position of the placenta can change. The answer is yes, it can. As your uterus grows and stretches, the placenta can migrate or move. This is especially true if your placenta is positioned low in the uterus early in pregnancy. However, it's less likely for a posterior placenta to move away from its position. In conclusion, a posterior placenta is not a cause for concern. It is a normal variant of placenta placement and does not indicate any danger for you or your baby. As always, your doctor or midwife will keep track of the placenta's position during your routine scans and will let you know if there is anything you should be aware of. I hope this information has been helpful and has eased any concerns you may have. Always remember, every pregnancy is unique, and the most important thing is that you and your baby are healthy.